Hi there, my name is Dorothy Pang and I am a licensed acupuncturist and I have been specializing in the enhancement of fertility for over 20 years now. And today I wanted to do a little video on a really good question. Someone asked me an excellent question, which I'm sure a lot of people have, which is where do you treat someone if they are a woman and they're having trouble getting pregnant, or if they just want to be more proactive about enhancing their fertility? And so I thought today I would demonstrate on a doll. So I could say Barbie doll, but this is technically Mulan, right? Because we always want to know what's going to happen, right, when we go in for treatment. And we've never had before, I absolutely understand. So let's see. The disclaimer that I have to add is that sometimes I need to do something a little bit more specific for the person that I see in front of me. And so the points, of course, will vary a lot of the times from session to session. But there are kind of like a bunch of points that are very commonly used for the women who have a chief complaint of trying to enhance their fertility. So the first thing I want to say is that there's not a ton of undressing when I do acupuncture. So every acupuncturist has their own specific preferences for how procedures are going to go. So I'm going to tell you about how things go in my office because, well, that's how I do them. It's not going to be necessarily how every acupuncturist approaches fertility enhancement. So I'm speaking on behalf of me, and this is what I do, and this is what I think works well. But if you go see someone else, it might be something completely different. There are so many different styles of acupuncture and methodologies and theories that if you go to someone else, it might not look the same at all. So what I'm talking about is what would probably happen if you come into my office, but I can't promise that if you see someone else, it would be the same, because every acupuncturist has their own preferences and their own lineages that they're studying under. So it'll vary. But for me, what I usually end up treating for my patients is, we have a little conversation about how their health has been doing lately. How are you lately? Is anything bothering you? How are you sleeping? We ask about kind of general lifestyle, because I don't know if you've seen any of my other videos, but if there's anything completely disharmonious about the body that feels not so good at the moment, then your body's going to be really focused on that thing. If you have, for example, terrible back pain or food poisoning, or you have a terrible cold, your body is not super concerned about enhancing fertility. First, it wants to make itself function well first. So first we have to make sure that your body is functioning well. So are there any, acute things that are bothering you that your body's feeling right now that are not that pleasant? So we talk about that, whether it's like, environmental allergies, or, oh, I've just been sleeping not well, or like, oh, I ate something bad and my digestion's not that great. We want to actually wrap that into the treatment too. I can usually treat a couple things at once, right? It's not just one chief complaint typically that I can help with. So, I can usually say, like, I can help you with, up to 3 things, maybe 4, depending on what they are. But I always have people rank them. And I know when we're doing fertility enhancement, of course, fertility is always number 1. But then again, if your body is distracted by something like a terrible back pain, it's not going to want to put any energy into fertility. So we have to take care of the more pressing issues first, so that your body can then refocus its remaining energies on fertility enhancement after it's feeling well again. Okay? So presuming that the body is feeling well, there's no major complaints about what's going on. We talk about that, right? I leave the room while the patient gets ready. So the patient would, sorry, so Barbie's wearing a one piece. It kind of makes it hard. But typically the patient lays down on the massage table while I leave, right? They get ready. If they're wearing 2 pieces, which typically, people do these days, they'll pull down the waistband a little bit on their skirt or their pants, and they'll pull up the pant legs or skirt up until just below the knee. So we have a little bit of skin here and a little bit of skin here. Nothing too scandalous exposed. And then I'll work on the lower belly and on the lower leg and a little bit on the head area for most women with a chief complaint looking to enhance their fertility. But like I said, again, if there's something else going on, we're going to have to actually wrap that into the treatment too, because an unhappy, imbalanced body does not want to put energy into fertility enhancement. So, I do my acupuncture. I'll probably add a little electrical stimulation, tiny bit. Electrical stimulation, if you haven't seen that video, it feels like a tiny tapping or tingling. It's just one small little battery going. It's really not a big deal, and usually fades after 5 or 10 minutes. So it's really not distracting at all. Typically, it just is no big deal. So if you're a little nervous about that, please don't be. It's very minor when we're talking about using it for fertility enhancement. So the acupuncture gets done, she lays and relaxes. I've got some amazing custom music that I play in the office that's especially programmed for deeper healing. Usually my patients fall asleep during their acupuncture session, and I completely encourage it. I think that's a good thing for people to get extra rest. And then about 30 minutes later, I come in, I remove the needles, and we're all set to go. And usually when patients are done with their session, they feel more relaxed. Sometimes people will tell me they feel tired after acupuncture, and I think that that's because often we're running on, let's call it like fake energy. Like when you have caffeine, that's not real energy, that's kind of fake energy. Or when you're running on like hormones, stress hormones, that's fake energy, and it's actually very costly to run your body on stress hormones. It's bad for fertility. It's bad for when you're trying not to like age your face and your organs. So you don't want to run on stress hormones. We clear out stress hormones during an acupuncture session. So if you've been running on those stress hormones, then yes, you're going to feel a little tired temporarily. But it's kind of a good thing because you don't want to run on stress hormones. It's not good for you. So most of my patients feel very relaxed after their session. They feel maybe like body parts might feel heavier. They might feel increased warmth in certain areas like the lower belly or the feet because their circulation has been enhanced. So the blood's moving more in certain areas, which is a good thing. We want that. We want more blood moving to our reproductive organs and even to like our feet, because in order for our blood to get from our heart to our lower pelvis, where our reproductive organs are, they gotta pass through there to get to the feet. So if women have cold feet, it's like not a good sign for fertility, because that means the blood, either there's not enough blood to get all the way down here, or the blood is not circulating as well as it could be. So it's a good thing to have warm enough feet, and it's not a good sign if you have cold feet. So they might feel, a little more warmth here, a little more warmth here, or even here because the circulation is better. The hands as well as the feet might feel warmer than usual. And those are all really good signs of after treatment care. But most women just feel more relaxed, which is absolutely fine. When we're more relaxed, we're in more of a body mindset to enhance fertility, because we're not under stress and nothing's bothering us, and so we can work on things like rest and repair and reproduction. So if you were curious about acupuncture for fertility enhancement, I hope this answers your questions. Again, just a recap, the most common areas that I use for fertility enhancement are the head, the belly, and the lower leg below the knee. So there's not a lot of taking off clothes. There's not a lot of exposure. I try to keep my patients warm. We have a heat mat underneath. We have a heat lamp on top. I don't like when people get cold. I just don't think that's a great thing. Very common acupuncturist sentiment. So also blankets if needed. So coldness, usually not a problem in the office. Not something I like. But if you have any questions, please comment, ask them to me. I love answering questions about acupuncture because I'm super into it. It's my thing. Once again, my name is Dorothy Pang. Oh, and if you have any, if you want a consultation, I'll put my booking link. I offer free consultations. I love to talk to people about their situation. They're 15 minutes on the phone, and I look forward to speaking with you if you have further questions. I would love to answer them. Okay, so this is me and Mulan, and we're signing off, and I'll see you next time. Bye for now.